Good afternoon, everyone. We have long said that vaccines will take us across the finish line of this pandemic. And that's why I'm pleased to join you today to announce yet another step forward in our vaccine rollout. But before I get to that, I want to celebrate an important step forward today as Alberta moves to stage 2 of our Open for Summer plan. We're here because Albertans have done their part. They've been vaccinated and helped to crush the spring COVID spike. Our COVID-19 numbers are moving in the right direction and getting better by the day. Currently, there are just over 3,800 active cases in Alberta, which is a 40% decrease from the 1st of June when stage 1 began. It's also the fewest active cases since the 23rd of October. Hospitalizations are dropping too. There are currently 306 people in hospital with COVID-19, with 81 being cared for in intensive care. That's a 31% decrease from when stage 1 began. Our R value, that rate of transmission, remains below 1, and our positivity rate, that's the percentage of folks tested who test positive, has been under 5% since the 2nd of June. Our numbers are low and dropping lower every single day. Simply put, we have done very well so far, and thank you for that. Not only in keeping cases down, but in making sure that vaccination uptake remains high. In fact, we hit the threshold for moving on to stage 2 back on May 27, 2 weeks ago today, before we even began easing restrictions as part of the first stage of reopening. So I'd like to, again, offer my thanks to every Albertan who has taken the step to get vaccinated. You've chosen to protect not only yourself, but those around you, and really to protect our whole province. So today, I'm very happy to say this officially: welcome to stage 2, Alberta. Beginning this morning, even more restrictions have been eased or lifted, and we are so much closer to a post-pandemic reality. Albertans can now go back to their gyms, go to their favorite restaurant with friends, attend small outdoor concerts. Faith groups can gather for congregational worship at up to 1/3 capacity. Up to 20 people can socialize outdoors. Personal and wellness services can resume walk-in service. Museums, theaters, cinemas, art galleries, and libraries can all open. Youth activities like play centers and adult sports activities and so much more can resume as of today. This is an exciting time for our province as we move into the last phase of this brutal pandemic. Our second stage keeps strong measures in place to help keep cases down, moving downward, while we continue vaccinating as many people as we can. We've also focused on doses for Albertans age 12 and older, not just 18 and older like many other places. And we did this because it's the safest approach and the best way to get open and to stay open for good. The foundation of all this is vaccines. We've now administered more than 3.2 million doses in Alberta. And as of today, 67.8% of all Albertans aged 12 and over have been vaccinated with their first dose. With 251,000 appointments booked in the coming days, we're not far from hitting the 70% threshold of first doses necessary to move on to stage 3 to full openness. But first dose demand is slowing. We need everyone to do their part. So the full opening of our province is in the hands of Albertans, especially those of you who have been maybe a little undecided about getting vaccinated. Please help us so you can get out to enjoy a great Alberta summer by signing up today to get your first dose. Of course, first doses are only part of our drive to protect Alberta. It was just last week that we kicked off the start of second doses, well ahead of our original schedule. And Albertans have heard the call. Since the 1st of June, we've seen a tremendous uptick in vaccine bookings. Albertans who received their vaccines, their first dose vaccines, back in March or earlier, have now largely booked their second doses. And when we announced the start of second dose bookings for Albertans last week, we said that those vaccinated in the month of April, like myself, would be able to book their next shot starting on June 14th, and that those vaccinated in May could do that on the 28th. But we also said that if incoming supply of vaccines allowed it, we'd open up more second dose bookings faster. So I'm very happy to announce today that we have achieved that, and we are speeding up the second doses for Albertans who received their first shot in the month of April, and we're doing that a week ahead of when we planned. Effective immediately, anyone who received their first dose in April can begin booking their second dose through Alberta Health Services or through participating pharmacies, and you can see which ones those are by going to the Alberta Blue Cross website. This means an additional 650,000 Albertans can now start booking their second doses right now. This is great news, not just for those who will be fully vaccinated sooner than they thought, but for everyone in the province who will benefit from widespread immunity. Every day we can get further ahead of schedule is another day closer to the end of the pandemic. I'm sure many of you are already patiently waiting in the booking queue as we speak, and you can get online and do that right now. With so many more Albertans able to book, phone lines and online booking systems for pharmacies and Alberta Health Services will be busy, especially in the first hours of expanded eligibility. I'm sure people understand that, so we'll ask for some patience, particularly today, tomorrow. If you can't find an appointment at a time that is convenient for you, please continue to check back as more appointments are being added every single day. Everyone who wants a second dose will be able to get one in the next few weeks. As Dr. Hinshaw mentioned last week, our own Alberta data proves that these vaccines are safe and remarkably effective. Since January the 1st, 96% of all confirmed COVID-19 cases in Alberta were either in individuals who were unvaccinated or who were diagnosed within 2 weeks of receiving their first dose, while their immunity was still building. The same holds true for 93% of COVID-19 cases that needed hospital care, and for 88% of deaths related to this disease. For those who have doubts, just look around you. There are literally millions of your neighbors and Albertans who have the vaccine now. They are well and they are safe. In fact, we've reported fewer than 500 adverse health responses to more than 3 million doses administered, meaning that 99.99% of vaccinations in Alberta have had no significant negative health effects. I'm pleased to see that we've made significant progress addressing and combating vaccine hesitancy, as they call it, in the province. But despite this progress, I'm still hearing that some believe that if others are protected, then they don't have to be. Well, I would say that's not the Alberta way to let others determine our destiny. Our opening, I should say, is not guaranteed, Alberta. We need to continue getting first doses into arms if we want to reach stage 3 and full openness. And we also, of course, need to keep adding on to the second dose protection. So please sign up to get your dose. Show up to get it, and make sure to follow up with your second dose as soon as you're eligible. Thank you to every Albertan who is doing their part by signing up and showing up for their appointments, getting us closer to the finish line. And actually, I wanted to just add a personal note, because I know that some misinformation is circulating about the safety and the efficacy of these vaccines. In recent days, I had a friend in his 70s pass away as a result of a COVID-19 infection. And I'm told by mutual friends that he had hesitated to get his vaccine because he had heard conflicting and confusing information about its safety. So I also have a friend, in this case in their 80s, his 80s, who is fighting for his life in intensive care with a COVID-19 infection. Again, likewise, this individual had been told that the COVID vaccines were unsafe and had heard lots of misinformation about the vaccines. So, folks, please, if you are hearing that kind of misinformation, please go online to Alberta Health Services, to official websites that are with scientific validated data to get your information. Please, if you have friends, neighbors, or members of your family who are holding back because of misinformation, please politely challenge them that they are putting their own health at risk, and they're also potentially could be the source of transmission to others who would be vulnerable. I don't want anyone else to end up in an ICU ward, or worse yet, passing away from this disease at the very last stages of the pandemic because of that kind of misinformation. So we all have a responsibility to combat that as well. Thank you, and with that, I will invite Minister Shandro to provide additional details on how to book your second dose.
Thanks, Premier, and good afternoon, everyone. As Premier announced, Stage 2 is here, a big step in terms of returning to normal life here in Alberta. It's great to get back to things that we've given up over the last 16 months, and the credit for it belongs to you, to the more than 2.5 million Albertans who've chosen to get vaccinated. And as Premier said, it was just last week that we kicked off bookings for second doses, well ahead of schedule. And there's been tremendous uptake. We've given more than 600,000 second doses to date, including almost 200,000 in just the last week. And we're taking a balanced approach based on the advice of the Chief Medical Officer of Health and the most current evidence. And as we approach our target of 70% first dose coverage, we're also accelerating second doses. And once again, we're leading the country. We're at about 16% of our eligible population fully vaccinated. And you compare that to nationally, compared to 11% for Canada overall. And I'm just going to repeat that one more time because it bears repeating. We here in Alberta have 16% of our eligible population fully vaccinated with 2 doses. And the rest of the country is at about 11% overall. And that's according to the COVID Tracker website. We're the highest of the 4 largest provinces by a wide margin. And now we're taking another step forward. Second dose bookings are now open for anyone who received their first dose of a Pfizer or Moderna vaccine in April or earlier. And you can book through AHS or participating pharmacies and physicians' offices. Appointments are available on a first-come, first-served basis. If you received the first dose of AstraZeneca in April, you can book your second dose too. We recommend you wait 8 weeks, though, from your first dose. And it's your choice whether you book a second dose of AstraZeneca or whether you choose for your second dose one of the 2 messenger RNA vaccines. Now, ramping up our vaccination program means that another 650,000 Albertans can now book their second doses. Now, of course, these doses don't deliver themselves. I want to thank everyone involved in the vaccine rollout. I want to thank AHS, our pharmacies, our physician partners for all of the work that they're doing throughout the province to help us get these vaccines to Albertans as quickly as possible, making us as a province leaders throughout Canada. And it's a huge project. It's being done just incredibly well, from the planning and the priority setting to the frontline work in every clinic and pharmacy where the shots are being done. Every day I hear from someone who's gotten a shot, and they almost mention, they almost all mention 2 things. First, they mention that the clinics are so well organized. And second, they mention that the staff seems so proud of the work that they're doing. And they're right to be proud of it. And we're relying on them to keep it up, because the supply is ramped up and the demand is ramped up right along with it. And while we're expanding second doses, we're also still booking first ones. In fact, there are about 71,000 scheduled over the next week. And I think some people may see us moving forward with second doses and think that firsts are not available anymore, or that we don't need people to book any more first doses. So I just want to take a minute to remind anybody who hasn't booked their first dose yet, you can still do it. We still need you to do it, actually. And we're working hard to reach Albertans who haven't been able to get a shot or have chosen not to. In the past few months, we've worked with partners to administer vaccines at temporary clinics, in shelters, in hockey rinks, meat packing plants, work camps, to name just a few. We're very close to our goal of first doses for 70% of Albertans who are 12 and over, those who are eligible. That will let us move to stage 3 and be fully open again. Now, if you have any questions, If you have any concerns about getting a vaccine, please call 811 or visit our website or talk to your healthcare provider. Get protected so we can all move forward this summer and put the worst of the pandemic behind us. Thank you, and I'll now invite Dr. Hinshaw to provide today's numbers. Dr. Hinshaw.
Thank you, Minister, and good afternoon, everyone. Before I begin, I want to let you know that I will be taking next week off to spend some time with my family. While I am away, my deputy, Dr. Andre Corriveau, and our health team will continue to work every day to protect Albertans. We will continue to post data every day, and I will provide another live update after I return. If there is time-sensitive information to share, my team will continue to use my Twitter account to do so in conversation with Dr. Corriveau. While I have been privileged to be the public face of our health response, I am but one member of a remarkable team, and they will continue to keep you updated and informed while I am away. Turning to today's update. The Premier has provided several of today's numbers, and I will share a few others. As always, more information is available on alberta.ca. Over the last 24 hours, we have identified 178 new cases of COVID-19 and completed about 5,500 tests. Our positivity rate was about 3.3%. While screening all positive samples for variants, we have identified 138 additional cases of variants of concern over the last 24 hours. Right now, 238 schools, or about 10%, are on outbreak or alert. As the Premier noted, hospitalizations continue to decline, with 306 people being treated for COVID-19, including 81 in the ICU. This encouraging trend is important to maintain, which is why, as we move into Stage 2 today, it remains critical for all of us to follow all of the public health measures that are currently in place. We can ease restrictions now only thanks to the combination of vaccine protection and the hard work and sacrifices of Albertans over the past many months. Let's not waste these sacrifices by abandoning too soon the practices that have brought us this far. It remains important to keep distanced and masked, to stay home when sick, and to keep protecting each other as we start enjoying some of the activities that are now possible. It's also important to remember that each of us will have our own risk assessment to do. COVID-19 is still with us, and we need to support each other in making the choices that are right for the context and risk factors that each of us have. Each of us needs to move at our own pace, and this is okay. We need to be compassionate and supportive of each other, in fact, now more than ever, as we move through this time of transition. Sadly, 6 new deaths were reported to Alberta Health in the last 24 hours, a reminder that we continue to see the impacts of the third wave. My thoughts are with the family, friends, and communities of these individuals as they mourn their loved ones. As I mentioned last week, and as the Premier mentioned earlier, the data from Alberta is clear. 88% of the COVID-19 deaths so far this year were either completely unimmunized or within 2 weeks of getting their first shot before they had protection. Getting vaccinated can literally save your life and the lives of those around you. And while 1 dose is a good first step, 2 doses are even better. That's why I'm pleased today that we are able to start offering second doses for many more Albertans. As we continue to face COVID-19 and its emerging variants, the sooner we can get everyone fully immunized, the better. I have stressed for months that 1 dose of the vaccine provides good protection, and it does. The evidence that we are seeing in Alberta, however, shows a significant jump in effectiveness after receiving the second dose. In fact, it's an 18% jump against infection with the B.1.1.7 variant, which is the dominant strain in the province right now. Given the choice between having about 73% protection or having about 91% protection, it is clear that completing that second dose substantially lowers the risk of getting COVID-19 and of spreading it to those around you. I also want to stress that our vaccine program includes Albertans who received their first dose outside of the province. We expect that there are thousands of snowbird Albertans who received a vaccination while they were away. We ask that they register their vaccination with AHS, both so they can ensure they get their second dose if they have not already received it, but also so we know how many people have actually been vaccinated. When you go to your appointment for your second shot, please remember to bring a copy of the immunization record that you got from your first dose. And if you've already received both doses outside of Alberta, please bring your immunization record to one of the 141 Alberta Health Services public health clinics around the province to have your immunization record entered into our health system. Finally, I want to end today with a plea. If you haven't gotten a first dose yet, please do it now. It doesn't matter what age you are or where you live. If you are 12 and over, we need you to get a first dose and then a second. Thousands of pharmacies, clinics, and physicians are booking appointments. Alberta Health Services has also opened up walk-in clinics for first doses in many places in the province. No appointment is needed in these locations, so check for hours and locations of walk-in opportunities online. Every dose matters. Throughout this pandemic, it has been the small things that have kept us safe. The regular washing of hands and staying distanced, the ordering online and meeting virtually or outdoors with our friends. If you haven't gotten a first dose yet, booking that appointment might seem like a small thing, especially when so many others are already getting the vaccine. The same goes for getting a second dose. But getting vaccinated is an example of a small action that has big consequences for your health and the health of everyone around you. Please get immunized. It's the best choice for you, your loved ones, and our collective community. Thank you, and we're happy to take questions.
Maybe also, just before we do go to questions, Harrison, just to say, in light of your comments before the update, to say through you to everybody on your team, thank you on behalf of all Albertans, whether it's Dr. Corvo, Dr. Johnson when she was the deputy, everyone else who works in your office, all the folks who are in the Emergency Operations Center who support you and your team. Thank you for everything that you have done and are doing to support the public health response. So thank you. Please let them know.
Thanks, Minister Chandro. We'll now move over to our media Q&A. Just a reminder, folks on the line, to please try to keep your questions brief so we can get to as many people as possible. And we'll be keeping you to one question and one follow-up. With that, operator, can you please put through our first caller?
Thank you. James Keller, Globe and Mail.
Hi, this is a question for Premier Kenney on Keystone XL. Now that the company has officially announced its termination, what options do you have, and are you still considering that NAFTA complaint?
Yes, thank you, James. So we want to first of all thank TC Energy for working with us over the past few months to come to a resolution about the windup of the project. We have a number of legal options on the table. Both of TC Energy and the Government of Alberta have engaged U.S. counsel since the beginning of the year to advise us on those options. I'll note that under the NAFTA or CUSMA Chapter 11 provision which allows applications to reclaim damages that result from a loss of investment, that application cannot be made until 6 months following a regulatory decision, which a damaging regulatory decision. So we would not be in a position to make an application under Chapter 11 until late July. We continue to remain in close contact with TC Energy about our legal strategy going forward, and we'll announce that strategy in due course. I will underscore that there is a joint action by, I believe now, 23 U.S. state governments, state attorneys general, to also challenge the U.S. administration's decision. And our lawyers are looking at the optimal moment to seek a status to make a amicus curiae brief in support of that 23 state challenge of the federal decision. So I'll just say that on the legal side, we continue to work on our options. We will defend our interests. We've always been clear about that. That's always been part of our Plan B or contingency. If there was to be the revocation of the presidential permit, we've always been confident about the multiple legal avenues that we have to defend our investment.
And do you have a follow-up at all, James?
Yeah, I'm just wondering what the argument is. I mean, you've talked a lot about regulatory uncertainty. I mean, this was an executive order. It wasn't through the regulatory process. And it's difficult to argue that, Alberta didn't know all of the risks last March, with the election, with the fact that the Trump executive order talked about the ability to essentially pull the order at any time for any reason at all. Is there any uncertainty here? Or is this just a matter of Alberta took a risky bet and it didn't work?
Of course, this was a political decision to use a regulatory power, the presidential permit over pipelines, to retroactively abrogate a permit that had been granted, and not to do so for defensible reasons, giving the project proponents zero opportunity to make submissions, which is a violation of basic principles of administrative fairness and administrative law. I think this meets every evident threshold of NAFTA/CUSMA Chapter 11.
Thanks, Premier. Operator, can you please put through our next caller?
Don Braid, Calgary Herald.
Yeah, there was a article in the Western Standard yesterday saying that you and some of your colleagues have been dining at an Edmonton restaurant in violation of COVID-19 rules. You've, of course, issued a fierce letter denying all that, but I'd like to ask you for your opinion on that, and I have a second question as well, but I'd just like to ask you what you're going to say publicly about that.
Well, first of all, Don, the story you're referring to is completely false. It is a fabrication from beginning to end. That restaurant I've only ever visited twice in my life. I think once was 2.5 years ago when I was Leader of the Opposition, and the last time was with a colleague for a rule-compliant lunch in July of last year. So this is a complete fabrication, and that's why our legal counsel has written to that website demanding a full and immediate retraction and apology. So I can tell you that I've never visited a restaurant that was not supposed to be operating, and when I have gone to restaurants over the past, during the whole period of the pandemic, it was in compliance with their rules. Typically, in the past few months, I've dined out a few times when it was permissible for restaurants to operate with one of my two designated close personal contacts or by myself to show some support for the industry during tough times, but the story is completely false, and that's why we are taking legal steps to demand redress.
And Don, you said you had a follow-up?
Yes, people are evidently saying things, and you've had people in your own caucus saying that you should quit right away. Do you see this as part of a whisper campaign or a campaign to force you out or just embarrass you to the point where you have to quit? And is it really a sign of a kind of deterioration of caucus discipline, to say the least?
Well, there's no doubt that the pandemic's been a bumpy ride for everyone in many ways, but that's also true for our government caucus. There have been very strongly held and passionate divergent views about the best response to the pandemic, and there's no sugarcoating that. A lot of that has been played out very publicly, and partly because, as you know, Don, I have welcomed a wider range of views on a range of questions than is typically the case in Canadian political parties. I make no bones about that. We ran on a platform that to expand the space for free votes, for example. I've told you before that I admire the British system, where there's a far greater range of views than is typically the case in Canadian legislatures. Having said that, Don, there's been some commentary, including from you, suggesting that there's this big internal divide. I think that is not the case. You wrote about a unsigned letter that had been circulated. Well, if people aren't willing to put their names to it, I don't think it really means anything. We've had, I think, 6 constituency associations out of 87 ask for an accelerated leadership review, but we've had dozens of constituency associations affirm my leadership and the direction of the party I lead. And that you mentioned an MLA who asked for a leadership review, who is now a former MLA because our caucus, a former UCP MLA, I should say, because our caucus responded very quickly to that. and the need for at least some basic parameters for caucus unity and discipline. So we are now very close to moving past this incredibly difficult time of the pandemic and moving into a period when we can focus on the consequences of our open for business, pro-growth policies. Alberta is leading Canada in economic growth. This week, the Conference Board projected 7.2% expansion of our GDP. We've recovered all of the jobs that were lost through the pandemic. We are having the best year in history in a number of our sectors. We're seeing huge momentum in diversification, but also in our traditional commodities industries. In other words, when we get into July and we get past COVID, this government will be able very clearly to refocus on the issues we were elected to address: jobs, the economy, pipelines, and strengthening Alberta's role in the Federation. I think it's going to be a great opportunity to reconnect with the folks who gave us that mandate.
Okay, thanks. Operator, can you please put through our next caller?
Lauren Boothby, Edmonton Journal.
Hello, this question is for the Premier and Dr. Hinshaw. If the Oilers 50-50 raffle from earlier this year is any indication, Albertans love a lottery. Are you looking at any incentives to encourage people to get their first dose, like other jurisdictions have done?
Yes, we are. I asked the Department of Health to come forward with options on incentives, including a possible lottery for people getting vaccinated, and work is ongoing. With that, there's a lot of creative suggestions. I know that when Ohio led the pack on this about 3-4 weeks back, there was a lot of ridicule directed towards them, but they've actually they saw an immediate and huge uptick in vaccination rates, particularly amongst parts of the population who right across North America have shown fairly low vaccine uptake rates. So I've asked that a little bit more research be done on that. I believe Minister Chandra will be coming back to our Emergency Management Cabinet Committee with options on that next Monday. There you go, Tyler, I just locked you in. And so we just want to make sure that the cost of that would be justified by the uptake in vaccines, in part by observing how this has worked in the U.S. But it's become quite a widespread thing down south. We're at the point now where we really have to start shaking the trees on for that first dose demand. We see predictably lower vaccine uptake amongst younger people, younger men in particular. And I don't think that's necessarily because of vaccine misinformation. I think that healthy younger people just generally imagine that they're less vulnerable to disease like this. And they're right about that. But what we need to persuade them of is that they have a social responsibility to their parents, to the vulnerable, to the broader community. And if one way of getting their attention to make that booking or come in and get the jab at a walk-in clinic is to enter them into some kind of incentive draw, then maybe it's worth doing. So we haven't made final decisions, but we're giving it a serious look. And I don't know, Doctor, did you want to add to that?
The only thing I would say is that if there is a choice to offer that, anyone who has their first dose can enter. So please don't wait. If you're making a first dose appointment,
that's a good point.
You are going to be eligible if a lottery goes ahead. So don't wait. Take the opportunity you have right now.
Thank you for clarifying that.
And Lauren, did you have a follow-up at all?
Yeah. So what happens if we, even if we do something like this and we don't reach that 70% vaccination threshold by the end of June or end of July? Are you going to hold firm to that number?
Well, first of all, just an update on the stats here. We are at, as of last night, 67.24% of eligible population with the first dose. And as Minister Chandra just mentioned, we have 71,000 first dose bookings for our system in the next 7 days, but we need 100,000. We need to hit about 100,000 more first doses. So we're just so close. I mean, we'll be, if everybody shows up that's made a booking in the next week for first dose, we'll be just like a couple of days shy. The frustrating thing is, we were doing amazingly well, and we still are, but we're only growing by 0.2, 0.3% of eligible population a day. So it's moving slow. Right now, we would be on track to hit the 70% around June 19, June 20 for an opening around July 3 or 4. I would love it if we could just, like I say, shake the trees, get an extra, 40,000 people to show up this week, and then we could have an Open Canada Day. So, in terms of if in the unlikely circumstance that just people stop showing up for first doses, I'll refer that to Dr. Hinshaw because there is a more complex analysis that her team engages in to define total population protection, one element of which is, for example, the additional protective effect of second doses.
Sure. So certainly, again, the calculations that we did about population protection and having that 70% of the 12 and older who had at least one dose took into account a certain baseline assumption of second doses. But of course, if we are holding at about 68, 69% first doses, and our second doses accelerate and we can get to a higher level of protection, that can be taken into account. But I want to emphasize that 70% is not a cutoff. We would love to see as many Albertans as possible protected. And so I would encourage all Albertans who haven't yet come forward to get the protection that vaccine offers to you and to those around you, to do so as soon as possible, because whether we're at 70, 71, 72%, every single dose that we give offers more protection. And so the ideal would be to achieve that high level of protection from first doses as well as second doses. But again, the work is underway to kind of look at what some of those equivalencies might be, knowing that our best case scenario would be to have as many Albertans as possible who have both first and second doses by the end of the summer.
Thanks, Dr. Hinshaw. Operator, can you please put through our next caller?
Andrew Lawton, True North.
Good afternoon, Premier. In response to the Keystone XL update, the opposition had accused basically your province for investing in this in the equity stake of incompetence. And I was wondering if you could respond to how the opposition has characterized that investment and whether you regret that in retrospect.
Well, the real reason the NDP opposed our investment to get Keystone XL built is because they've always opposed Keystone XL, just like they've always opposed pipelines generally. The Alberta NDP openly and publicly opposed the Northern Gateway pipeline. Ms. Notley openly and publicly opposed the Keystone XL pipeline. The NDP government did nothing to fight back when Justin Trudeau effectively killed the Energy East pipeline. And so it's not surprising that an anti-pipeline party would be opposed to a government trying to build pipelines. This government was elected on a pledge for jobs, economy, and pipelines. And that meant going to the wall. It meant taking risks. It meant being proactive. It meant not surrendering to the campaign by foreign-funded Green Left pressure groups to landlock Canadian energy. And so we made a strategic decision to invest in the project, to keep it alive so it could move forward. Ultimately, of course, Albertans don't control American electoral outcomes or the decisions of American administrations. But our strategy, we were elected to create facts on the ground. Had we not stepped forward with this investment, I can tell you that TC Energy would have pulled the plug on its project in the fall of 2019, after having invested over $6 billion and a decade on it, because of the political, the lack of access to capital as a result of political uncertainty. We believe that at certain strategic moments, it's necessary, if we are going to have a future for our energy workers, it's necessary that sometimes the government steps in to de-risk projects that have become too risky in the capital markets. That's exactly what the federal government did with Alberta's urging with respect to the Trans Mountain expansion. I think that was the right call. If they had not done that, we would have lost the opportunity to get coastal access. So we were elected to fight on all fronts for a future for our energy sector, to create facts, not to surrender. And I'll just say this, we helped with that investment to create several thousand jobs here when they were desperately needed during the economic crisis last year. And they're is pipe in the ground. And who knows what's going to happen in 3 years. And finally, Andrew, we are confident that we'll be able to reclaim our investment or to get damages out of a legal process. That was always part of our contingency when we entered into this, eyes wide open.
And Andrew, did you have a follow-up today?
I do. I know, Premier, you have, and your government has advanced forward in the process of putting the referendum to Albertans in October. I've talked to a lot of people who are unhappy with the status quo, and they say that a referendum that isn't really binding on any particular outcome is not enough. And I'm wondering if you could speak to why you aren't interested or haven't been thus far interested in expanding the referendum, perhaps asking some questions about ways that Alberta could unilaterally assert a little bit more independence.
Well, the referendum on the principle of equalization that we'll have in October is exactly what we promised Albertans we would do at the last election. The vast majority of Albertans that I've heard from strongly support the opportunity to speak on that principle and really to use it as a symbol to speak about the unfairness which Alberta has faced for decades in the Federation. The fact that we've paid so many of the bills for Canada, but we've had governments crushing our ability to generate the wealth that we share across the Federation. So this is a chance to speak to that unfairness, to highlight this, to create political facts, and to elevate our fight for fairness to the top of the national agenda. It's true that a yes vote on that referendum does not end equalization, and nor does it change the formula. I've always been clear about that. What it does, in our view, it compels the federal government to negotiate the issue of equalization with us in good faith. That's what the Supreme Court of Canada said in their 1998 Quebec secession reference. They concluded that if a province holds a referendum on a proposed constitutional amendment with a clear question, and if a clear majority votes in favor, then the federal government has a binding obligation to negotiate that amendment with the province in good faith. So that's the theory behind this referendum, and it's not the end of the road. Andrew, in the fight for a fair deal for Alberta, we have to look not just in the short term. It has to be a long-term strategy. We have to have multiple leverage points where we can increase the pressure for fairness over time. We continue to look very seriously at other recommendations of the Fair Deal panel, including a potential Alberta pension program, which would allow us to keep about $4 billion a year back here at home because of our young population and our large workforce, our demographic advantage, as well as the potential benefits of community policing through an Alberta provincial police force. I always think if it's good enough for Ontario and Quebec, sure enough, it's good enough for Alberta. So the referendum this fall is not the end of the line. It is just another important step in Alberta's strategy to assert itself in the Canadian Federation.
Thank you, Premier. We have time for about 2 more callers today. Operator, can you please put through our second last caller?
Lauren Pullen, Global Calgary.
Hi there. Thanks for taking my question. This is for both the Premier and Dr. Hinshaw. Just a bit of clarity on Lauren Boothby's last question there. Are we sticking with the 70% benchmark, or are we going to start factoring other things in, like second doses, as Dr. Hinshaw mentioned? And when would we start factoring those things in? Is there a date, or what's the benchmark?
Doctor?
The ideal benchmark is 70%, at least first doses, and that is actually a benchmark. As Albertans are looking to the future, the ability to move forward as quickly as possible into stage 3 would be by achieving that 70% benchmark. And again, as the Premier mentioned, we are extremely close. So that is the number one option. And so if, as you know, had been asked over the next few months, we see that we're stuck at 69.5%, but our second doses are increasing, there's no specific time frame or cutoff, but again, it's an assessment of what would be that equivalency. But if Albertans are keen to move forward, having that first dose target achieved would be the quickest way to be able to move forward into the kinds of activities that we've all missed. And again, that's the primary and preferred target.
Thank you, Dr. Hinshaw. Did you have a follow-up, Lauren?
I do, thank you. This is also for Dr. Hinshaw. We know that there is data showing that the Delta variant is less protective with just one dose of vaccine. So I've been hearing many questions about the outbreaks at Foothills Medical Center and vaccination levels. Can you tell us how many of the patients and healthcare workers diagnosed with the Delta variant connected to those outbreaks at FMC have 1 or 2 doses of vaccine?
I don't have the current statistics. I do know that as of Tuesday, when the statistics were provided to me at that point in time, we did see in one of the outbreaks that there were 10 individuals who had completed their second dose and still unfortunately ended up becoming infected. What we're monitoring now is whether or not they had, as we would expect, a milder course of illness. I don't have data on the number that had a single dose or no doses at all. And again, I want to emphasize that we do see a small number of people who have completed their immunization who can still go on to get ill. Again, as we've talked about before, the vaccines are about 70 to 80% protective after the first dose, 90 to 91, 92% protective after the second dose. So there still is a portion of people who can go on to become infected. With the Delta variant in particular, we are watching very closely our experience. I don't have, again, the current data. On Tuesday, it represented about 5% of our overall new cases, so still a very small number. We're watching that closely, and we know from the data in the UK that after a second dose, the effectiveness of mRNA vaccines boosts to, again, the high 80s, approximating that 90% coverage. So while we can see a few cases that have broken through the vaccine, the vast majority of people who are vaccinated will have protection. And again, that's part of the reason we're accelerating our second dose opportunities, and we'll continue to do so as long as supply allows. We'll be able to offer Albertans second doses as quickly as incoming supply permits.
All right, thank you, Dr. Hinshaw. Operator, can you please put through our final caller of the day?
Rick Bell, Calgary Sun.
Good afternoon, Premier. We still keep following sort of some of the line of questioning that Don Braid did earlier. We still keep hearing that somehow there'll be some serious challenge to your leadership by MLAs. But of course, none of this pans out, including at the caucus meeting today. I mean, how much unrest is there really, in your opinion, in the UCP caucus? And do you see your leadership in jeopardy in any way?
The answer to the second question is no. And I think the answer to your first question is reflected in how our caucus responded to a couple of MLAs who were trying to drive wedges and destabilize our party in government. They were promptly asked to leave. So there has been tension. There's no secret about that in our caucus, in my party, over the past 16 months of COVID, the last 6 months in particular. And there's been some tension and disagreement. And at times it's led to some really frank debates internally. But I think I know that the vast majority of Conservative MLAs and members are excited about the opportunities that lie in front of us. They are happy to have a government that has kept 80% of its platform commitments. As I've said before, I don't think there are any Conservatives who are upset with the government that repealed the carbon tax, that sued Justin Trudeau over it, that is suing him over Bill C-69, that brought in the Open for Business Act, that has cut over 120,000 regulations, reducing by 20% the regulatory burden of the province. I don't think there's any Conservatives disaffected by a government that restored parental authority in education, that's offering the Back to Basics curriculum that we promised, that repealed the Bill 6 attack on farmers, that has done everything possible to get pipelines built. I don't think there are any Conservatives that are upset that we kept our commitment to bring forward important democratic reforms like recall legislation, that have brought forward Citizens Initiative, that creating a chief firearms officer, an Alberta parole board, that is keeping its commitment to an equalization referendum. I think that once we get past COVID, we get to refocus on the issues that unite us, which are vast. And I think so much of this noise that you've been hearing about is a small number of people whose size and presence have been exaggerated. I think our team wants to move forward, focused on the future, on the issues we were elected to deliver on: jobs, the economy, pipelines, and a strong Alberta.
And Rick, did you have a follow-up at all?
Yes, just a quick one. There are still some people, I mean, it may be a very small number, perhaps you could tell us, of people who are still pushing for a fall 2021, so that's this year, leadership review. And I'm sure that's not the first time you've heard that. Is that also, in your opinion, a small percentage of the party, and do you think that has a chance of happening?
Well, I can just tell you this. I think I've had one UCP member of the legislature propose that to me and speak in favor of that I know of. And I think 2 or 3 of the 87 constituency associations. What you folks who write columns about this stuff, like I know as you knew Rod Love very well back in the day, Rick, and he used to say that you guys are fight promoters, and I get that. But I'll tell you this, we've had dozens and dozens of Conservative constituency associations pass resolutions affirming support for my leadership in the general direction of the government. And so I appreciate that. I especially appreciate their patience, because I know behind that there are a lot of people who've been frustrated with the tough decisions we had to take over the past few months. No Conservative goes into public life in order to suspend entire areas of economic and social activity. This has all been like literally painful for many of us. But I think the vast majority of folks get that. They understand that, and they understand that this is coming to an end. So I think there's actually, and I sense this from our caucus meeting today, a sense of truly renewed optimism. I'm not trying to pretend there haven't been any tensions or differences, but I think they've been significantly exaggerated.
All right. Thanks, Premier. And that concludes our media avail today. Thanks so much for joining us.
Thanks, guys.